day everyone, I am Geraldine Pagaduan, a student nurse from St. Augustine. Today, I will be performing bed bath. Now, what is bed bath? Bed bath is to perform in a bed given to a client who isn't able to bath himself or herself. The purposes of bed bath is number 1, is to clean the client's body from germs or any bacteria that may foster in the skin. Second is to stimulate circulation and improve general muscular tonic. And third is to give them comfort and help them to go to sleep. And lastly, number 4 is to observe skin condition or any other objective symptoms. So in performing bed bath, we are guided by the following guidelines. First, confirm doctor's order. Second, check identification and condition. Third, grade client and establish record. Good day everyone, this is Nurse Geraldine. So for today's video, I will be performing bed bath. So for the initial procedure, I have to greet the client and validate some information about him or her. In validating information, we have to observe the wristband of our client and also ask the client to state his or her name and birthday. Hello, good day. I am Nurse Geraldine. Can you please state your name?
My name is Mr. R.D.
When is your birthday?
18/7/2014.
Good. Hello, Chriselle. How are you?
I'm okay.
Good. So today, I will be performing bed bath. I will be cleaning your body while you are in bed so that the germs and any other bacteria cannot foster in your skin. So, and also to improve your body. Blood will flow perfectly in your body. So, can we do this procedure together? Good. After establishing rapport, we need to prepare all the equipments that we need for bed bath. So, I have all my equipments here. Before we proceed, prior to performing bed bath, we need to perform proper hygiene. Let us now proceed with the next step. Get the basin full of water and we need to let our client check the temperature if the water is okay or comfortable. Now proceed to remove the pillow and put the towel under his head and also a towel over his chest. After the initial procedure, we may now proceed cleaning the eyes of our patient, making sure that we don't use soap as it may irritate the eyes. So, in cleaning the eyes of our patient, from inner surface to outer surface, using different side of the palm. This is to avoid sweeping debris to the eyes of our client and also to avoid the spread of infection. Now we can proceed to cleaning the face of our patient. So in cleaning the face of our patient, we can use soap only if we prefer it. Remember that soap is drying to the face. We may also follow the number 3 pattern from the forehead going to the nose and from the nose going to the chin. We may also want to include the ears of that we're done to the upper limb, we can now proceed to the cleaning the chest and the abdomen of our client. One thing to remember here is to put the towel under the trunk of our patient so that we may avoid wetting the bed. Also put back the towel over his or her chest so that we may be able to provide privacy that our client needs. After performing the procedure, we can also change the water that we are using for bed bathing. Number one is because it might have cooled down already, and the second one is because it could have done cleaning the chest and abdomen of our patient, we are now going to change the water before proceeding to the next step, which is cleaning the lower limb. Now that we already changed the water that we are using, we can now proceed to cleaning the lower limb. So in cleaning the lower limb, we have to bend the knees of our client. This will allow us to have easier access to the top leg and also to the bottom part of the leg. And if necessary, we have to provide pillow underneath the knee so that we may be able to provide support. In cleaning the legs of our patient, we also want to start from distal to proximal. So from the foot of our patient to the knee, and from the knee to the upper leg of our patient. After cleaning the lower limbs of a patient, we may now proceed to cleaning their back and their buttocks. First thing we have to do here is to turn them on a lateral position. This will allow us to have easier access and visualization of their back. all the steps in bed bathing, we have to make sure that the client is comfortable before we